President-elect Donald Trump is gradually removing some of the suspense around his appointments to key cabinet positions. On Tuesday, he announced he was choosing House Budget Committee Chairman Tom Price as his Secretary of Health and Human Services, the agency that's expected to dismantle the Democrats' 2010 health care overhaul. Price, a 62-year-old former orthopedic surgeon, is one of several GOP physicians who sought to carve out a leading role in shaping the party's health policy and an alternative vision to the Affordable Care Act. The WSJ's Louise Radnofsky and Peter Nicholas report that much of Mr. Price's criticism has centered on the authority the ACA gives the federal government and to the agency he may now head. Quote, "We think it's important that Washington not be in charge of health care. The problem that I have with Obamacare is that its premise is that Washington knows best," the six-term congressman said in an interview this summer. Since 2009, Mr. Price has pushed his own legislation called the Empowering Patients First Act, taking a position on a number of hot-button issues. In the latest iteration, the proposal includes refundable age-adjusted tax credits for people to buy insurance if they don't have access to coverage through an employer or government program. People in a government program such as Medicare or Medicaid would also be allowed to opt out and get tax credits toward the cost of private coverage instead. If he's confirmed by the Senate, Price will run a 78,000 employee department whose responsibilities go far beyond the Affordable Care Act. They include running the Medicare insurance program for the elderly, overseeing the Medicaid insurance program for low-income Americans, operating the Food and Drug Administration, and advocating for public health with the Centers for Disease Control and Prevention. Trump also on Tuesday named Seema Verma, a consultant who helped Vice President-elect Mike Pence negotiate a groundbreaking Medicaid deal with the Obama administration, as the head of the Centers for Medicare and Medicaid Services.